Hi, I'm Dr. Hudson Garrett, and I'm an adjunct assistant professor of medicine in the Division of Infectious Diseases at the University of Louisville School of Medicine. And I'm here with the March Aerobotics Clinical Newsletter article. One of the things that constantly frustrates me as both a clinician and a healthcare executive and leader is complacency. And it's a term that sometimes we just don't talk about. And it's going to be a focal area for my article this month. Taking evidence-based practice to the next level, making sure it meets the needs of not only the patient, but also the clinicians that have to administer it is critical. We talk often about the term evidence-based practice, EBP, bring the guidelines to the patient, but what does that really mean? A guideline is a starting point. It's really a template, a resource, a place for us to say, how do we take what we know works, maybe adapt things that we don't necessarily have all the information for, and build a framework, right? But it's not the full ceiling. The other piece that I think is really critical for us to relate to is the power of interprofessional collaboration and not accepting that that's all the way that we've always done this as an example, or we don't have time to do this. The thing that I always go back to is the patient in the bedside has one single expectations, and it's not that they want mediocre or average care. It's that they want perfect care. And whether that's your parent, your loved one, your child, your loved one, it doesn't matter. They are all there accepting that they place their trust within us as healthcare providers. And whether it's air, water, environmental surfaces, it doesn't matter. They are expecting us to give them the highest level of infection prevention and control. That's one of the things that we have to strive to do each and every time.